and welcome to the CNBC TV 18 special. I'm Shireen Bhan. India's COVID caseload has started to rise again, crossing the 11 million mark. A 31% spike in active cases week on week is worrying government officials across key states. Maharashtra has seen a rise in cases after about 70 days of stability, with some regions like Amravati and Yavatmal being placed under partial lockdown to manage the rise in cases. Maharashtra has seen 16,991 active cases last week, and a total of 259 deaths were reported versus 35 deaths in the previous week. Chief Minister Uddhav Thackeray has warned that a fresh lockdown may have to be imposed if daily cases continue to rise over the next 2 weeks. Now, the state has already decided to put a halt on all political, religious and social gatherings. To discuss the situation specifically in Mumbai and the tools at hand, I'm now joined by the BMC Commissioner Iqbal Singh Chahal. Mr. Chahal, always a pleasure. Many thanks for joining us here on CNBC TV 18. I want to address the issue of Mumbai specifically with you, sir. Given the kind of case rise that you have seen, do you believe that there is need to put in any additional restrictions at this point in time? Or do you believe that the situation remains comfortable, there is adequate healthcare infrastructure available, and perhaps a call on any further restrictions will have to wait for at least a fortnight or so?
Good morning, Shreen. First of all, thank you very much for providing me this opportunity today to present the current situation of COVID in Mumbai. I'll answer your question in two parts. First, let me give you the vital statistics of the last 8 days since this surge started. I will call it a surge, not a second wave right now, and I'll explain why. You know, on 14th of February, when it started rising, we used to have 350 to 400 cases a day in the last about 60 days. But on 14th of February, we got to 529 cases, and it kept on building up by 100 addition every day. Therefore, yesterday we had 700. Yesterday we had 850, and today morning reports of that is yesterday's. It is the cases have gone down to 750 now from 950 as compared to day before yesterday when we compare with yesterday. And if you see our positivity, we had been maintaining a positivity about 4% in average. And on 14th of February, the positivity was 4.5, which has now become 6.5, the slight increase in positivity. However, two important indicators. One is the deaths. Our deaths are 3 to 4 in single digit continuously since the last 8-9 days. Like yesterday, we had 3, day before we had 4, and on 14th of February also we had 4 deaths. And second issue is that unlike March till Diwali last year, we used to have almost 50-50 ratio of symptomatic and asymptomatic cases. You know, symptomatic cases need medicines, they need treatment, they need hospital beds, but asymptomatic don't need all these medication or treatment. And against 50-50 ratio, this new strain of virus which has come in, it is producing almost 85% asymptomatic, which means only 15% need medication or they need to go to hospital as per the last 8 or 9 days of figures available to us on an average. Like, for example, today morning, when I got yesterday's figure, we got a figure of 750, out of which only 100, to be very precise, 108 are people who would ultimately go to hospital beds as per the list, although the list is 750. And another indicator is that we had started our trains from 1st of Feb, and I've been telling everybody that after 3 weeks, maybe 2 to 3 weeks, we'll come to know the additional outcome of putting 45 lakh people on trains every day. So now this is exactly 3 weeks today, and I can attribute about 100-200 case increase to this mega rush in trains also, which were lying shut from since last March till 31st of Jan. So if you add those figures, our increase is not much. Say on 14th of February, we had 529, and today we have 750. But I am really, at this point of time, there is no need for us to relax. There is no need for us to be complacent. Things in Vidarbha, in the eastern part of Maharashtra state, in districts like Amravati, then Yavatmal, then Nagpur proper, things are not comfortable at all. there the positivity has gone beyond 10%. In some places, the positivity is 15%. And we are afraid of that wave coming this side. And similarly, even in Pune, if you add district as a whole, including Pune city and Pimpri and the rural areas, the figures have gone beyond 1,000. So we to make ourselves little immune to what is happening in the rest of the state, we decided to double up the testing since 14th of February. And 2 days back, that is on Friday, we did the highest ever testing since last March, since the pandemic started. Our testing was almost 23,000 on a single day. And that was another reason why more cases started coming up. But our good thing is that our positivity is well under control. But when I say all this, it is very important that next 15 days are going to be very critical for Mumbai as how things unfold. But with very robust infrastructure which we have, or the health department, we have 15,000 beds lying empty. We have 1,000 ICU empty. We have almost 7,000 oxygen beds which are available to people in case they need it. And we have 1,000 ambulances on our dashboard, and we have very robust online dashboard of 147 hospitals where we do allotment through a single dashboard. So all these things are very reassuring, and especially when only 15% people are coming symptomatic.
Okay, so several important numbers that you've given us. You're saying that the positivity rate is on an average about 6% at this point in time, and there is adequate healthcare infrastructure. 15,000 beds are empty, 1,000 ICU beds are empty. So let me just get you to clarify once again, Mr. Chahal. At this point in time, for the Mumbai circle, you are not looking at imposing any additional restrictions beyond the current restrictions that are already in place. So whatever is the current SOP, you will ensure adherence to that, but no specific additional restrictions will be brought in at this point in time.
Well, Shireen, yesterday evening, Honorable CM Sir had undertaken a Facebook address to all our 125 million people in Maharashtra, and he made amply clear that the government is strictly against lockdown, and the government doesn't want lockdown at all. And even at BMC, we don't want lockdown at all. But if you see, let me give you two very important statistics here. In the slums, we have containment zones, and in non-slums, we have sealed buildings. Now, since 14th of February, when this surge started, you will be surprised that containment zones have fallen down. They were 91 on 14th of February, and now they're 88. That means the virus load has gone down in the slums, whereas the entire additional load is coming from the middle class, the rich, and the super rich. And their sealed buildings have gone up by almost 400 buildings in the last 7-8 days. So this calls for very responsible, COVID-appropriate behavior by our citizens of the middle class and the upper class. And because there is no increase of cases at all in the slum areas. And our Honorable CM Sir rightly said that it is up to our eminent citizens whether they want a lockdown or not. Now they must follow the no mask strategy. They should wear masks all the time. They should not come in public domain without mask. They should maintain social distancing. They should ensure that they adhere to COVID-appropriate behavior. Like yesterday evening, I was sent some videos from Juhu Beach, and there was tremendous crowd there. There was shoulder-to-shoulder crowd there. People not wearing masks, not following social COVID norms. That is very, very unfortunate. Like for example, yesterday we inspected a couple of marriage venues. There are thousands of people gathered without masks, and we've been fighting them, prosecuting them. This COVID-appropriate behavior doesn't come, then we are in for a problem, maybe after 2 weeks from now.
Okay. How many establishments have been booked in the last 1 week, Mr. Chahal, for non-compliance with the SOP, with the protocols? How many individuals have been booked, for instance, for not wearing masks in public places, etc.? Can you give me some sense of the action that's been taken by the BMC to ensure compliance?
Yesterday, Shireen, we fined 16,400 people in BMC for not wearing masks, and we collected almost 33 lakh rupees. And this is the highest ever figure since the last 10 months. We have fined almost 15 lakh people, 1.5 million people over a period of time. But our average was about 12,000, 13,000 fines a day. Yesterday, we went to 16,000, and I have given a target to all my team that we must at least fine 25,000 people every day not wearing masks to enforce this mask regime. Secondly, another important thing we've done is we have given the powers of marshal to fine to the entire police department. So that all 50,000, 60,000 police personnel in Mumbai, now they'll act as a marshal and they can fine anybody, catch anybody not wearing a mask. We have to be ruthless as far as COVID appropriate behavior is concerned. And you'll see in the coming days, within the next 2-3 days, these fines touching 25,000 per day.
Today, 16,400 people were booked for not wearing masks, the highest in the city of Mumbai since the start of the pandemic. Mr. Chahal, I would imagine that the hope is, of course, that there will not be any additional restrictions and that the numbers will be contained. But if you were to move towards additional restrictions, I would imagine that there will be a graded strategy. So what are you looking at over the next 8 to 10 days? Will you look at further restrictions when it comes to transportation, especially on the local trains? Will you look at restrictions for cinema halls, restaurants, hotels, etc.? What will the response be if you feel the need to move ahead with restrictions?
Shireen, we are not planning even a single new restriction. Let me make it very clear. But we will go for extremely strict implementation and adherence to the existing SOPs for COVID condition. For example, marriages, not more than 50 people in a marriage, we are going to strictly enforce this. Secondly, 50% attendance in cinema halls, 50% attendance in theaters. We are going to strictly monitor and we're going to prosecute the organizers if they violate this condition of 50% attendance. And if you have marriage venues where people call hundreds and hundreds, we are going to prosecute the parents of the bride and groom if they flout this. Similarly, as far as our religious places are concerned, we are going to put female marshals there in Mumbai and ensure that there's no crowding there and there is proper social distancing followed without any new restrictions. We are going to ensure that people stick to the SOPs. Next, like playgrounds, sports complexes, we'll ensure that here also, whatever SOPs are existing in place, they should be adhered to. And beyond this, the biggest problem right now is our asymptomatic positive people. Now, like I said, 85% of the new cases are coming asymptomatic. They have no symptom, no temperature, no bad throat, no treatment required, no hospital required. They're just like you and me, absolutely normal. Now, these people, we have been, in the last 8 days, the net addition of symptomatic is only 300. But the net addition of asymptomatic is almost 3,000. You can imagine. And these 3,000 people with no symptoms, they always tell us that they're going to be home quarantine. But I'm sure they roam around, attend weddings, they attend marriages, they roam on trains, they go to malls, they go shopping, because for 14 days, they feel very boring sitting at home with no symptom, but they are COVID positive and they can infect. And I have no doubt that these are people who are spreading the virus in the market. Now we have done 6 things for them since Friday. Number one, the moment our war rooms early morning, 8 o'clock, is going to inform them that they are COVID positive, we'll visit them and stamp them that they are asymptomatic positive. Number two, we'll put the onus on society that they should not loiter around. Number three, if the society gets more than 5 asymptomatics, we are going to seal the society building. Number four, if these fellows are found on the public domain, you are going to lodge FIR on them and put them in compulsory quarantine. Number five, we are going to tell our war rooms that our doctors are going to call them 5 to 6 times in a day and check up whether they are actually available in the house by ringing them landlines. So once these asymptomatic people are taken care of, the infection in the public domain is going to come down.
Okay. Mr. Tell, I just wanted to get a clarification from you. You know, like there are restrictions as well as a screening process to be followed for people, for instance, coming in from Delhi when we talk about domestic travel into Mumbai, or international travelers coming in from Europe, UK, Brazil, etc. Are you looking at imposing any kind of screening for people who might be coming in from Amravati, Yavatmal, the Akola Circle, etc.? Is there any plans on any kind of screening on interstate movement?
You'll be happy to know that since 22nd of November, when we first got inkling of this UK strain, we had made institutional quarantine compulsory for the entire Europe, entire Middle East, South Africa, and now we added Brazil also from Friday. Now, regarding the trains, we have been doing surveillance of passengers at the various railway stations. And since we have limited capacity of RT-PCR, we can't conduct RT-PCR for the 50,000 people who are getting in every day. But we have been scrutinizing them and taking random antigen tests of these people when they arrive at the railway station. And we'll continue this SOP.
Okay. And no restrictions on travelers coming in from Kerala, etc., RT-PCR test requirement. Are you looking at that? Because the Delhi requirement of people from Delhi arriving in Mumbai still require a RT-PCR test. So are you looking at that from any other state as well?
No, Shireen, we have already done it. Last week, we started RT-PCR test for anybody coming in from Kerala. That is already in place now. But like Honorable CM Sir said, that whether lockdown or not after 15 days, 20 days, it is entirely in the hands of our eminent citizens. They have to decide whether they want lockdown or not. We don't want any lockdown at all.
Okay. Yes, you've made that amply clear, and I think the Chief Minister made that clear. Let me end by asking you, Mr. Chahal, what is the plan as far as vaccines are concerned? How much stock does the BMC currently have? There has been some degree of slackness in the vaccine plan, not just in the state of Maharashtra, which in fact has done better than other states. But what is the situation on the ground? Is there a hesitancy from people to take the vaccine? And more importantly, when do you expect the phase on 50 plus being able to be vaccinated start?
You know, Shireen, as far as vaccination drive is concerned, rightly so, the government of India has decided to drive it campaign from national level, because to vaccinate 135 crore people, you need a single window of driving it. And I fully agree with that strategy. Now, on the 16th of Jan, the first phase started where we covered our healthcare workers. And the phase 2 started on 4th of February in Mumbai, when we started doing our frontline workers. So as far as Mumbai is concerned, these two put together roughly 3.5 lakhs. And for the entire country is about 3 crores. I don't see any hesitancy at all. But the issue is that the COVID app, it has a lot of issues. It is not functioning properly, and we are now dependent on our ward war room, where our ward war room doctors physically ring up the concerned people to come to our points for vaccination. And because of malfunctioning of this COVID app, this drive has got a little setback. Otherwise, I would say that things are going fine. Still, without this app also, we are doing about 13,000, 14,000 vaccinations per day. And day by day, people are coming forward. And in fact, lot of people are inquiring from me who are 50 plus that they want a shot. But unfortunately, unless Government of India gives the directions and unfolds phase 3, till that time, we cannot do anything.
Is there any indication, sir, because one was hearing that perhaps in March, the phase of allowing 50 plus to also be vaccinated could kickstart? Has there been any indication on that, on the timeline? Could it be March?
Shireen, I expect that by 15 March, this phase 3 should unfold as per the directions of Government of India, and then we'll go whole hog to vaccinate as many people as possible.
All right, Mr. Chahal, of course, you will have to wait to hear from the government of India. The central government will take a call on when states will be allowed to administer the vaccine to 50 plus. But important commentary coming in there from the BMC Commissioner. The lockdown is a last resort. That is not an option that the government wants to consider at this point in time. No additional restrictions are being brought in, but there will be strict adherence to the current restrictions, to the current SOP. And the hope is that the numbers will be contained. So far in the city of Mumbai, adequate healthcare infrastructure, 15,000 beds available, 1,000 ICU beds available as well. Mr. Chahal, always a pleasure. Appreciate you joining us here on CNBC TV 18 to give us a very detailed status check on how things stack up for the financial capital.
Shireen, I'd like to add 2 more points. First is I'd like to make a very humble appeal to our citizens. I'd like to make a very humble appeal that it really pains me when I move around in the city and I find so many people not wearing masks and tremendous crowding everywhere. And when I get reports of thousands of people attending a wedding ceremony, it is really, really very disgusting that in COVID times, there are 2,000 people, 3,000 people in the marriage venue. This has to stop. People must realize that we are living in COVID times and COVID is not over. A lot of people think that the COVID is gone thing. It is part of our life now. We have to be very careful. So I would make a humble appeal through your channel to all the eminent citizens of Mumbai, that citizens of Mumbai have been most well behaved right from March, and they have been listening to BMC's prayers and requests. Now also, with folded hands, I request all our eminent citizens to cooperate with us to avoid crowding, to avoid this mass weddings, so that we don't end up in a situation that we are left with no options.
Absolutely, and we hope that people pay heed to the advice as well as the advisories that are being put out by various state governments as well as the central government to follow COVID-appropriate behavior. Mr. Chahal, always a pleasure. Appreciate you joining us here on CNBC TV 18. Well, that is the message coming in from various state governments. You just heard it from the BMC Commissioner. Follow COVID-appropriate behavior because no one wants to go back into a situation of more restrictions and certainly not a lockdown. With that, it is time for us to wrap up the CNBC TV 18 special. Thanks very much for watching.